Hi, everyone. Yehudis Shamroth here from Ramat Beit Shemesh, Israel for Wellness Wednesdays. It's a little bit of a different time today. Just didn't work out for me to do it at 2 o'clock or 3 o'clock or 4 o'clock. So I'm doing it now at 2:30. Welcome back. If you have never tuned into one of our programs, I discuss a lot of issues about health and wellness from week to week. And sometimes I have a guest on, sometimes I don't. I just discuss things. I look at a lot of research on a topic and I try to give it over in a way that's concise and takes away all the problems of trying to wade through all the information and the misinformation out there. Today's topic is a continuation of last week, which is infertility treatments from the alternative perspective. Last week, I interviewed Eliza Levine, the top herbalist of Jerusalem, who is also a nurse midwife, and she has a clinic. She makes herbs for all kinds of medical issues, but she specializes in women's issues and especially infertility problems. She is on the staff of Shaare Zedek and both Shaare Zedek and Hadassah hospitals here in Jerusalem, and she is so well world renowned and locally renowned to have such success with her herbal medicines to help people conceive that most programs insist that their clients and their patients go to her for herbal treatments while they're undergoing IVF, in vitro fertilization, and while they're trying to get pregnant too. And this is something that we'll discuss at length. It's not really a long show today. I don't have that much to say. She said so much. And you should go to the YouTube channel, Ramat Beit Shemesh RBS Acupuncture YouTube, if you want to hear Eliza's interview again. It's really worth listening to. I'm going to talk about the aspect of having acupuncture today for infertility and for pregnancy in general. So again, I will just review a little bit of what Eliza spoke about with herbal medicines and how they can help. And we want to know how acupuncture can help also. And that's what I'm going to share with you today. Here we go. Okay. So infertility. Let's just talk about that for a second. Medical professions will define infertility as being unable to conceive after having unprotected sex for 1 year. So women who are unable to remain pregnant may also have infertility. Women who get older, women who have PCOS and other medical problems, they have fibroid tumors in their uterus. There are all kinds of irregular periods. There's all kinds of reasons why people are having a hard time conceiving. Could be from the male problem as well. But the CDC, infertility says the infertility affects about 12% of women ages 15 to 44. So, and there are about 1 in 8 couples in the United States alone that have experienced infertility. And so people are always constantly trying to find ways to improve their health or try to find new treatments and methods to help themselves and their partner conceive. And this is where Chinese medicine comes in. And Chinese medicine, by the way, has been used for thousands of years in helping women conceive. But it's just until recently that the medical population of the United States and the rest of the world is very, very happy to involve Chinese medical practitioners in the process because what Chinese medicine does, it helps make the body stronger overall. And this is one of the reasons why people don't get pregnant. They can be, Eliza said last week, they could either be just dehydrated on a very deep level, or their digestion could be very poor, or their immune system is very low, all kinds of things that will be treated by acupuncture and Chinese medicine. And then the fertility can happen naturally, or the IVF, the in vitro fertilization treatments can happen more effectively because acupuncture and Chinese medicine do so much to make the body heal and also do so much to make the body stronger. So we know that infertility is a very life-altering burden for people, for a couple. It really plays havoc on their emotional health and wellness. And there's limited treatments of options for IVF. Women have to pay. My daughter-in-law is an infertility nurse in New York City area, and she said they probably pay $10,000 each time they go through an infertility round. And that includes taking injections every day and eating special foods, and they also receive acupuncture, and they have to have the eggs retrieved, and they have to have the husband donate the semen. There's all kinds of things that have to go on. It's very, very stressful, the most stressful thing a couple can ever do. And here they're just trying to get pregnant. Some people just get pregnant by looking at a man or a woman or whatever. Some people just get pregnant and easily, and they're lucky ones. They're the lucky ones. And then there are those who find that they have struggled to conceive, and it really wreaks a lot of havoc on their emotional health and their physical health as well, because of all the chemicals, the injections, the hormones. The hormonal changes make them very depressed or upset. They don't sleep well. It's a very difficult process, and some women have to go through this over and over again until they either conceive or they give up, unfortunately. We do know that it's a very costly procedure. Some people use donor eggs. It causes a lot of psychological distress, emotional distress. But we do know that turning to something like acupuncture and herbal medicine can really help in ways that people just never imagined. It can improve the ovarian function. It can prevent miscarriages. I know I take care of many women for acupuncture alone who have prolapses in their body, like prolapse uteruses and hemorrhoids, and anything that's considered a prolapse falls under a certain category in Chinese medicine for lower body, needs lower body strengthening and digestive strengthening. And those are the kind of problems that could maybe cause the miscarriage, for instance. A woman has a very weak lower body, and it can be strengthened by Chinese medicine and acupuncture. So we do see a lot of success with Chinese medicine. And we do see that it offers a lot of hope for people who, especially in older age groups, who have failed IVF cycles over and over. And the repeatability of this infertility should be know that there's a lot of clinical trials out there proving this. So just again, to talk about infertility, Aliza Levine spoke at length about this last week, but just to review, we do know it's widely sought after now, Chinese medicine, for all kinds of gynecological disorders, not just infertility, but anything like irregular periods, amenorrhea, endometriosis, uterine fibroids, heavy bleeding, anovulation, all kinds of things. And so from a traditional Chinese medicine perspective, infertility is caused by an imbalance in the body. So we have to figure out what that imbalance is. And it's usually something having to do with the kidney or the liver or the spleen, which take on much greater roles in Chinese medicine. And as I've said so many times before, if you know enough about Western medicine and you know enough about Eastern medicine, there are no contradictions. But having said that, the Western medical model doesn't really, they look at the kidney function for just what we know, which is immense. The kidney does so much for the body, the liver does so much for the body, and so does the spleen. But Chinese medicine, we look at these as systems and they're interconnected so much more than we talk about in Western medicine. So we have to strengthen the systems. We have to strengthen the interconnectivity of the systems. And we have to see, even sometimes there's a hyperactivity of some of these systems, and we want to tone that down. We talk about the concept of qi in Chinese medicine. That's energy, life force. And yes, that's also true in Western medicine as well. We know that there's an imbalance of something happening in the body, whether it's blood flow, nervous system flow, oxygenation. We're not sure what it is, specifically all the time. I mean, you can do testing to find out if there are blocked tubes, obviously. There are testing to find out if there are tumors in your system. There are block tests. There are tests that can tell how many ovaries are produced for the women and how much sperm for the men. We know there's a lot of, this is not what I'm going to talk about today. I'm not talking about how do you get tested for, infertility and whose fault it is and whose issue it is. And that's not what this particular webinar is about. But we do know there are many, many physical causes to infertility. But basically, the Chinese model is looking at the imbalances in the body. And so by treating the root causes of infertility through Chinese medicine, we can strengthen these reproductive organs and the rest of the body. And we can do this naturally without any invasive procedures or hormonal drugs. And then if you have to go for IVF, it's important to continue the herbal medicines and acupuncture through the IVF procedures, because your chances are much greater of success. And there are many, many studies to support this. So we talked last week with Aliza about how people come to her and she is like a detective, and she has to figure out what is actually the root of the cause of their problems. Are there irregular periods? Is it hormonal? Is it their age? Is it their ovaries are just pooped out? If their husbands have a low sperm count because their diet is wrong? We can find all that out with extensive questioning. And they have already gone to other doctors for their physical tests and their blood tests. So we don't really have that much to do with that part of it. We do ask a lot of questions about their cycle and their history, their menstrual history, and so on. So we can have an advantage of having Chinese medicine treatments that we make individual formulas for the people. You don't just take something off the shelf. So even if you do have fibroids, uterine fibroids, or if you do have a history of miscarriages, plants have an affinity for every part of the body. And it's great that we're getting back to them now, because plants when they're extracted properly and made in a proper solution, they can, ingested, they can safely and effectively just increase the overall health from the inside out. So if you have a problem with, like I mentioned before, with lower body weaknesses and you're having miscarriages over and over, we can give herbs that can strengthen the lower body and cause a lot of tightness in the uterus. If we can give herbs to help regulate hormones. So that's acupuncture, and herbs are fantastic for regulating the menstrual cycle. And so we want to do this all while someone is trying to conceive, and maybe it's just a matter of an irregular cycle. I remember my husband telling me, he's an OBGYN. He said after the Holocaust, so many women were having problems with infertility. They had been without their periods for maybe 2 years during the Holocaust. So it took a long time for their bodies to come back to regulation and normal. But also, we live in a religious situation. The Jewish people, many people follow laws of family purity, which means they only are allowed to have intimacy a certain time of the month. And when we look at that very carefully, sometimes it doesn't seem to be enough days that couples are allowed to be together. And so the Rebbeim, the rabbis, of course, will make exceptions for this because they want you to have a baby. So it's not just a hard and fast rule. You can only sleep together now and then you have to wait. Yeah, there's a lot of intricate rules about this, but sometimes for these ladies, they had to make exceptions and let them be available to their husbands. They wanted to anyway, I hope, be available to their husbands more often during the month, so that because their cycles were just totally, completely knocked off. And some of them didn't even ever have children. Some of them thought they would never have children, but when they changed enlarged their availability to their husbands, they were able to conceive. So it's just sometimes a matter of looking at their menstrual cycle and trying to get them back into shape and back into phase. We do know there are different phases of the woman's menstrual cycle. I'm not going to talk about that, but I do know that there are, because there are all kinds of classes out there and all kinds of internet information, and a lot of women do know a lot about their bodies anyway. So we know there's a follicular phase, ovulation phase, a luteal phase, and the menstrual phase. So there are 4 different phases that we really focus on in regular Western medicine and in Chinese medicine. And we do find out that what herbal medicines, again, I'm going to get to acupuncture in a minute, but again, to continue with the herbal medicine story, we do know that we look for why a person is having problem in each phase. We look at their blood tests very carefully, just like the medical professionals do, because we want to see what all of their hormonal levels are, the FSH and so on. We want to make sure they have enough progesterone and estrogen and where it is in each type. We're educated to know these things. And we do find out very often that in the follicular phase, we can focus on replenishing blood and kidney essence. The kidney is the strength of the body in Chinese medicine, so we can give herbs for that. For the ovulation phase, we can support liver circulation and activate the blood flow and remove any blood stagnation, because the liver does that naturally, but sometimes there's a problem with that. So we can, during the ovulation phase, we can strengthen the liver with herbal medicines and acupuncture. During the luteal phase, we can warm up the kidney and the lower body and support implantation for early pregnancy, so that people and support the strength of it, so the baby can stay in there and not be released so easily with people with lower body weaknesses. So basically, what the herbal medicines, and they're all different ones, you can look them up on the internet. I'm not even going to list them, other than maybe some of them you might be familiar with. Most of them are Chinese herbs, by the way, other than astragalus and dangui. Those things are actually well known to people. But there's a lot of different Chinese medicines that are specific to strengthening the body, improving the blood flow of the uterus, and strengthening lower organs, improve blood supply to the reproductive tissue, improve blood supply to the organs function, promote fertility in all different ways by regulating the hormones. Because a lot of them are antioxidant, improve the quality of the egg itself. They can scavenge for free radicals, these antioxidant herbal medicines. Gucci is one of those, and that nourishes the blood greatly. And that's just the goji berries. Goji berries are an amazing thing. If you eat them regularly, you can actually nourish your blood, and you can scavenge for free radicals and inflammatory problems that sometimes are at fault for women not being pregnant, not getting pregnant. We can get rid of blood stasis with herbal medicines. Stasis means there's something that the blood is just not flowing well. We can regulate the blood flow and regulate not just the hormones, but the blood flow itself, so it doesn't collect and accumulate at the wrong time of the month. There are some herbs that are anti-fibrotic, which means that they will break up any kind of fibroids, or they will help move them along or shrink them. So all in all, the herbal formulas are used to do all different things to strengthen the cycle at different times, and they can be anti-inflammatory. They can stimulate the pituitary gland to improve ovulation and to regulate hormones. It's just really amazing that people haven't gotten onto this sooner, but we do know if you look, more and more people are very, very interested in using herbal medicines. Okay, if you're already pregnant, let me talk about acupuncture for a minute now, because that's what I've really meant to do, and I don't want to talk about it for too long because it's just something. It's just basic information. I'm not educating people on the menstrual cycle or how to prepare for in vitro fertilization, which I think I will at some point, because I will interview my husband and my daughter-in-law, who are specialists in this area, and why not bring the medical professionals in here as well? We want to know, if people want to really know about this, there's a whole routine that has to go on, a whole preparation. But if you're already pregnant and you want acupuncture, you can have acupuncture during pregnancy. A lot of people don't realize that because, again, as I mentioned, acupuncture can help prevent miscarriages. It can help you cope with morning sickness. I've taken care of numerous women with morning sickness and helped them a lot. We can alleviate body aches. There's a woman who called me last night. She said, my leg hurts, my lower abdomen hurts, and I'm getting sciatica down my leg. And the truth is, some things you have to wait until the baby's born in order to, because the baby might be sitting right on that sciatic nerve or something. But we can help really give a lot of relief and pain relief to women who are very uncomfortable. And it supports, acupuncture can support pregnancy fatigue as well, including all the good foods and all the vitamins and things you might need to take along with pregnancy. So as a normal pregnancy, if you have one, thank God for that. And you can have acupuncture to treat a lot of different things during your pregnancy. So don't think it's only for infertility, because it isn't really. So when we combine acupuncture with herbal medicine too, I wanted to mention that we can have much more effective treatments. The acupuncture alone is good, and the herbal medicines are good, but the two of them together, there are some, my daughter-in-law tells me that in New York, in her infertility clinic, it's mandatory for people to have acupuncture and Chinese medicine in their IVF clinic, which is pretty amazing that the medical community has accepted it to that degree. So we want to look at the alternative treatments for infertility and how they combine with medical treatments. Just to mention for a moment, there are a lot of different causes to infertility. As I mentioned, that the ovulation disorders can be aging, diminished ovarian reserve, premature ovarian failure, and endocrine disorders like PCOS. We do know that a lot of women suffer from PCOS, and a premature ovarian failure is something that Lisa mentioned last week, and it's women going into early menopause, which is very unusual, but it's been happening a lot more lately. And it could be from the stress of the world, stress of our lives. It could be from processed foods. It could be from, people working, burning the candle at both ends, and a lot of stress in our lives. So a lot of things can cause women to go into premature ovarian failure, and that can be dealt with Chinese medicine and acupuncture. But another more causes of female infertility, you can have pelvic inflammatory disease, which of course are treated medically by antibiotic, but also herbal medicines are very antiviral and antibiotic as well. Tubal surgery, usually people have, they can, if they have, sometimes they want to reverse their tubal surgery. It is very difficult to do, to put those two ends of the tubes back together. So that can be a problem for becoming pregnant later on down the line. If people have had a previous ectopic pregnancy, and if they've had one ovary, a salpingectomy, I can say this, by the way, I've said it for years. Salpingectomy is taking out the uterus, or taking out just one tube and maybe leaving the ovary behind. But if you're missing a fallopian tube or an ovary, that cuts down your chances of conception. And the uterine causes are any kind of abnormality. Some people have a split uterus. They have two different sides of the uterus. Some people are congenitally born with different problems like tumors. They might have something after birth that grows later on, fibroids, endometriosis, poor quality cervical mucus, and so on, and infection over and over. And that's what the pelvic inflammatory disease can be a very big detriment to women, because if they have it over and over, and it's unfortunate, it does cause infertility because of all the scar tissuing that happens from it. So we look at male infertility. reasons, and it could be a hypothalamic thing. From the hypothalamus controls all the hormones, pituitary insufficiency, could be infections over and over, or testicular atrophy if they're older. They can have some chromosomal problems. They can have retrograde ejaculation, like the sperm can go backwards instead of out, and that can cause a lot of blockage and infection. They can have some kind of immunological disorders, like the sperm they just were born with poor sperm, and they can have psychosomatic disorders too. So it's very important for these things to be properly addressed before, not just the women, the men and women. You see them as a unit, whether you're Western or Eastern medicine. You have to see them as a unit and help them both out with whatever. And if people have structural things, if they have tubal blockages, if they have fibroids in their uterus, if they have testicular problems, they have to be addressed medically, obviously. And the herbal medicines and acupuncture are very great assistance to that. These are medications that we see often used: antioxidants, gonadotropins, anti-estrogens, which sounds very counterintuitive, but sometimes the anti-estrogens will just control the estrogen at certain times of the phase, which I'm not going to go into, but they will actually increase the estrogen at the right time, control it for the right time. We give a lot of vitamins. So I'm not going again. This is not a lesson on how to go for infertility, but just to show you and highlight what acupuncture and Chinese medicine can do to assist you. So let's talk about acupuncture again for another minute. It's all about balance. As we know, the whole body, everything has to be balanced, and whether it's hormones or stress. And so acupuncture is always about restoring balance and overall health and well-being. And so we know it involves an insertion of very thin, sterile needles at strategic points in your body, called acupuncture points. And by stimulating these points or pathways, it's believed that we can correct any imbalances, whether they be energetic or they be blood flow. But we do know that acupuncture, we have a lot of success and evidence to show that, again, just going back to pregnancy, I'll say this in a minute. We know we can regulate the menstrual cycle. We can balance hormones. We can improve blood flow to the reproductive organs. We can improve sperm count and motility, decrease the risk of miscarriage, reduce stress and anxiety, and improve the chance of pregnancy overall when they're having IVF. So this is just, again, if you're a person who's already pregnant, again, don't be afraid to have acupuncture. You support your digestive function. It relieves physical and mental stress. It can improve blood circulation in the reproductive and all organs of the body. It regulates ovulation and fixes menstrual issues and stabilizes hormonal fluctuations. So this is for if you're just trying to get pregnant normally, or whether you're struggling with fertility. Again, just to repeat, we can increase the blood flow to the uterus. We can improve the uterine lining. Some women come to me and they look at their blood tests. They have almost no uterine lining by measurement. And that's also, they're told by their doctors, well, you're not going to get pregnant because you have no uterine lining. But guess what? You can use herbal medicines and acupuncture that plumps that right up and makes it nice and cushiony for the baby to implant. So don't give up. If you're told that, just try this at least, because it really, what do you have to lose? It can only help you. It either won't help you or it will help you greatly. That's what I tell all of my patients when they come to me for acupuncture and Chinese medicine. I'll say it can help you greatly or it won't help you at all, but I'm not going to hurt you in doing this. We can increase ovulation and menstrual regularity. We can reduce stress and promote relaxation. It goes on and on. So when it comes to women's fertility and men's fertility, again, we have to focus on different things for each individual. So for the women's side, the acupuncture and Chinese medicine can harmonize the body and mind, strengthen vitality, and strengthen your immune system, relax you, regulate menstruation. Again, some of this is repetitive, but it's really important to see that acupuncture and Chinese medicine is a good regulatory tool. It can nourish the uterus. It can support healthy ovarian function. It can balance your hormones, improve egg quality, thicken the endometrium, as I mentioned, and support embryo implantation. And from the men's side, acupuncture, Chinese medicine, we can improve the sperm health. We can count the motility and the morphology, meaning the shape of it and the size of it and the quality of it. It can help you improve sexual performance. Some of these herbs are known to be, sexual arousal kind of herbal stuff. It helps you with libido and ejaculatory function. It can improve the whole body constitution. So if you're clearing dampness and boosting kidney issues and strengthening the body overall and gets the body to move the energy or the nervous tissue or the blood flow, it can only benefit everybody. Even if the pregnancy doesn't manage to come to fruition, we are really strengthening the body overall. So when it comes to in vitro fertilization, I'm not an expert on this, but I just found this slide very interesting because we know that we just know what is it anyway. What is in vitro? If you have to get to a point where you're not going to get pregnant on your own with herbs or without, or with medications or without, some of the medications will cause hyperovulation. That's why people have so many multiples when they're going through infertility treatments, because you give a medication that produces the ovaries just keep popping out more and more and more ovaries, or more eggs, and you're likely to have 6 or 8 babies if you're really not careful. It doesn't always happen that they can stay that long, but a lot of the eggs are frozen. I know that, so you can have it for later on in your life if you need to. But many people opt for multiples, and I actually have a patient right now who's got 4 4-year-olds at home right now, which sounds amazing, blow your mind kind of thing. 4 4-year-olds. And they're doing great, but because they went through in vitro fertilization, and they decided to keep all 4 and see if all 4 could make it. And the doctors told them the babies wouldn't manage, but they did. They stayed, and they all were born at 2 or 3 pounds or something. They were very small, but boy, they're amazing right now at 4 years old. So anyway, going back to in vitro fertilization, the doctors will give women hormones, and it cause you to super ovulate and develop and release many eggs at once, as I mentioned. And then once the hormone treated woman has many mature eggs, that you take it surgically removed from her ovary and put it in an egg in a refrigerator, in an environment that keeps it alive and well. And once removed, the eggs can be combined with a man's sperm in a laboratory dish again. It's called in vitro. That's the in vitro part. And the process of sperm joining the egg is called fertilization, as we know. So let's talk about acupuncture during these phases. Before the IVF, or the whole entire implantation, we can, with acupuncture and herbs, we can calm the patient and relax the uterus, and we can prime the body to ensure optimal condition for IVF. During the IVF treatment itself, during the follicle stimulation phase, we can strengthen the spleen and kidney to enhance the response. And the follicle stimulation hormones was what you need. We want to use acupuncture and Chinese medicine to make this the most maximum it can be at this phase. And meanwhile, supporting the liver to, like I mentioned earlier, to improve blood flow and to the ovaries and the uterus. And that way, if you're improving the blood flow to the ovaries and the uterus, you're improving overall quality of everything, and also thickening up the endometrial lining, which is very crucial for implantation. So after the cycle is over with, and you want to the IVF embryo, if you have to transfer the embryo back into the mother, acupuncture and Chinese medicine can improve circulation and reduce stress again, and improve the blood circulation in the uterus, and helps maintain the implantation and nourishment of the embryo. So it's like a win-win situation. Really is fantastic. Okay. I just wanted to say that if anybody is interested in more information about this, you should contact me at rbsacupuncture.com. I'll be happy to discuss this with you. I have helped many people. I am not the most expert in infertility in this area of the world. There are more people more experienced than me, but people have taken a chance on me because I've had some successes. I always say that if you want to have any procedure done, whether it's eye surgery or dental work or in vitro fertilization, you should probably go to the people who do it more often and do many, many, many hundreds a year, and not to the people who only do 2 a year. But basically, when it comes to Chinese medicine and acupuncture, the well-trained acupuncturists could probably be great to help you. Like me, I'm great. But if I feel like somebody's going to be a big challenge, I will send them to the experts. There are several in Jerusalem. I can give you their names if you want to call me. And people who do this and nothing but this. So this is, there's something to be said about going to the top of the field. I never claim to be an infertility expert. I just claim to be somebody who can direct you, help you with as best as I can, strengthen your body. But one of the things I help with people with is their lifestyle, their diet. So here are just a few suggestions of what they have, something called a fertility diet. And they're usually very, very healthy foods overall. Spinach, grapefruit, broccoli, zinc, sweet potatoes, all those things for both of them. Eggs, wild salmon. I'll talk about why in a minute. But you want to avoid excess dairy, excess alcohol, both male and female. Anything processed, any refined sugars. And this is what we talk about every week anyway, whether we're on a diet or we're trying to deal with our diabetes patients, or whether our cardiac patients are, obese patients. We say the same thing every week, okay? Eat the healthy whole foods, and they're folate rich, and they're healthy fats, and avoid the dairy, the delis, the beef burgers, fatty foods that are not good for you, fatty oils. And this is one thing I found that I thought was very good for women in particular. I've got a little description if I can get to my last page here. that you're eating properly, whether you're just trying to get pregnant or not. It's just, but once you find out that you're pregnant, you got to start on herbal medicines, and you want to really eat properly. This is not, you can't wait till the last minute. You want to get yourself in good shape before you get pregnant. And I think that's something that women overlook often. And we're not instructed by our mothers or our doctors as much. We want to get pregnant. So we say, okay, fine, now start eating well. No, you should really start eating well long before you want to get pregnant, because you want to have your body in its healthiest state possible. So you should start eating like this a year before you want to get pregnant, 6 months, something like that. You don't have to take hormones or anything, or even the herbal medicines, but eating properly is got to be something that people should emphasize more than they do, because at the last minute, and also coming when you're an older person, you have to understand the body really was built to have children at a younger age. I was an older mom, and I could tell you it wasn't difficult to get pregnant, thank goodness, but it took a lot out of me being a 35, 38, and 40-year-old pregnant mom. It was not so easy. So I know the 20-year-olds they also suffer, of course, but they get over it faster, and they seem to snap back a lot easier. That's just how the human body was created. So let's just talk about the foods for a minute. We know the seeds, any kind of seeds, roasted or sunflower seeds, especially, a lot of vitamin E, and then you need nutrients. You need a lot of good nutrients for good sperm and good eggs. So for vitamin E and omega 6 and 3 fatty acids are really high in, I found in high amounts in, in eggs, and in also in the whole milk products and dairy. You can avoid dairy if you have to avoid dairy, but if you want to eat dairy, use the really healthy dairy like the goat's milk, and the good yogurts and things like that. Mature cheeses are also known to have improved sperm health, and they're found in all kinds of products too. So you can, but make sure they're natural products. Don't go to packages that have been sitting on the shelf or in the refrigerator for a long time. Um, a lot of the pasteurized dairy and the healthy dairy will have a lot of good vitamins A, E, D, K, and potassium. You need all these minerals and nutrients for a healthy pregnancy, and give you the full fats that you need, because everything in the body, all hormones start off as cholesterol and fats, and you need to have that nourishment of healthy fats in your body. And you can get it from the dairy if you like to eat dairy. You can also get it from avocado, and you can get it from olive oil, you can get it from eggs. Beans and lentils can contribute they have high in fiber, which is good for the whole digestive overall, and folate, which is part of iron. And we need a lot of iron. Women take iron supplements quite often when they're trying to get pregnant. And also the beans and lentils have the kind of folate that can, it's something called polyamine spermidine, which helps the sperm fertilize the egg. Um, we have asparagus is on every single list that I've looked at. It's not on this one for some reason. Let's see if there's asparagus. Okay. These are fertility boosting foods too. Asparagus, all the green leafies, obviously, because they're antioxidant. And the asparagus in particular is almost on every single list because it's nutrient packed superfood, low in calories, and gives you a boost of fertility and vital nutrients. So you can get your vitamin K and almost all your essential vitamins with just a couple doses of a couple cups of, if you want to eat asparagus that much, but people do. People will eat 2 cups of asparagus a day trying to get pregnant. Same thing with oysters. I had that in the previous slide. Oysters it's on just about every fertility list as well. And you get B12, you get zinc, you get selenium, you get iron, you get a lot from oysters. Some of us kosher people won't eat that, but you'll eat other things. Pomegranates coming from Israel. It's not on any of these pictures. They're also long been associated with fertility and birth due to the many seeds. That's sort of a wives' tale, but it's true because it's the best antioxidant fruit out there. And again, inflammatory bowel disease or inflammatory uterine issues, infections, PID, and all those things can be really reduced greatly. And in all your bodily functions can work better if they don't have all the free radicals and antioxidants running around. You want to eat something that's all the free radicals, antioxidants are what take care of them and support the cell health. And you need to support the cell health of both the sperm and the eggs. Walnuts have omega-3 and omega-6 fatty acids, and that's good for sperm count, they've found. Egg yolks, all the iron, calcium, zinc, vitamin B, folate, and vitamin B12 that you want. Also happens to have vitamins A, E, D, and K. So this kind of, if you like to eat eggs, it's a great thing to keep on your diet. wild-caught salmon in a similar situation. It's a healthy fat. It's got vitamin D, selenium, and vitamins. And you can get all your recommended value of nutritional vitamin D from eating fish every single day. And with that, I'll just say that you've got to take good care of yourself overall before, during, and after being pregnant. And I will repeat Aliza's. Actually, you can see a replay of Aliza from last week talk about herbal medicines, and she's the herbalist expert. She's the one I go to for my advice and my herbs. So if you want more details, you'll have to call her, make an appointment with her. But in the meantime, just remember that that infertility is something that is a very big struggle for people, and we understand that, and we're here for you, and we want to try to help you as much as we can. And thank God there's something like this that expanded your possibilities of having success, because you don't have to rely just on the medical and surgery and medicine. It's a beautiful blend of both Western and Eastern medicine. And again, alternative medicine, acupuncture, or Chinese medicine will only enhance the situation and get your body into a healthier state. So with that, I will say goodbye and have a really wonderful week. And if you want to discuss infertility, here's Aliza's number, her clinic number there. Call her secretary, Naomi, or you can contact me at rbsacupuncture.com. Please have a wonderful, wonderful, healthy week. And thank you for joining me.